Afternoon, I'd like to call the October 10th, 2016 Human Services Committee meeting to order. First up, we're looking for an approval of the agenda. We have a motion and support to accept the agenda. Are there any corrections, deletions, additions to the agenda as printed? Seeing none, all in favor say aye.
Aye.
Opposed? We have an agenda. Next, we have public comment. Is there anyone that would like to address the committee? Seeing no public comment, we will move on to committee items. We have the meeting minutes from September 16th. We have a motion and support to accept the meeting minutes as presented. Seeing no additions, corrections, all in favor say aye.
Aye.
Opposed? The meeting minutes are approved. Lifeways monthly report. Hello and welcome.
Good morning. Oh, it's afternoon. That's right, it is, isn't it? Feels like the morning's been going on and on. Okay, so good afternoon, everyone. In front of you, you'll see the this month's report from Lifeways. A couple of things I'd like to highlight related to the report. First one is related to our Stomp Out Suicide event that we had. We had over 240 individuals attend that event that we had down at Michigan Theater. It was a great event. And afterwards, it was held at night, and we did a candle walk in memory of. It was really well attended, and appreciate the community's support of that. The other notice that I'd like to bring your attention to is the fact that we had applied actually in 2012 for an integrated health grant. At that time, it was through SAMHSA. It's a federal grant. We were denied. It's very competitive. We again applied in 2015, and initially were told we did not receive the award. Earlier of this year, of 2016, they contacted us and said, were we still interested? Obviously, we are still interested because it's a key funding that would allow us to move integrated health further within our organization, and we just received notice that we did receive that grant. It is a grant for 4 years, $400,000 a year for a total of $1.6 million, and it will allow us to really look at our population, and especially the high-risk population related to those that have comorbid conditions, and be able to address and integrate physical health care for that population within our center. So that is going to be a great opportunity as we move forward, and we'll continue to keep you appraised as that happens. The next item that I'd like to bring your attention to is related to the work we've been doing to really ensure that our organization is prepared for both the opportunity related to community behavioral health, the certified community behavioral health clinics that I've talked about here before, and also the threat that's still out there related to Section 298, and that is the privatization of the public mental health system. So as an organization, one of the things strategically that our board has put as an objective is to align ourselves to be able to be competitive if that threat does occur, or be able to demonstrate the ability to meet the standards of the CCBHC. So we're doing that. We've done a lot of work over this past, since January of this year, really trying to do some organizational restructure, also looking at ways that we can create efficiencies with our staff. And so we have had a reduction of staff just through attrition through our access area, and when we look at really streamlining functions and creating efficiencies. The other thing that we've also put into play is what's called open access. So prior to July of this year, when somebody was in need of services at Lifeways, you'd call, they do a brief screen over the phone, or if you're in person, they do a brief screen, and then they would set up a follow-up appointment, which for you to come back. And that just really isn't very customer friendly for you to have somebody who has been in crisis to say come back and we'll do a full intake and then connect you with appointments. There's a model out there called open access in which whenever that person needs treatment, you do that intake then and connect them with the follow-up appointment right there. It did require some changing of processes, but we do have that in play now so that if somebody comes to Lifeways, we don't then give them a follow-up appointment for the intake. It happens right there. And we do believe that improves the consumer's experience of care. The other important thing to look at when you look at page 3 of the report is related to Mid-State, and they track what's called penetration rates, and what that means is of all the eligible individuals that you have in your community, so they look at both Medicaid and Healthy Michigan, and they want to see that you're continuing to increase the number of people who are eligible in your community. And for our region, the good news for Lifeways is we have, over the course of the last couple of years, seen those numbers increase. We are reaching a broader population of our community, and we're actually above the average when you look at that report. So of the 21 county region, for Lifeways, for Medicaid, we have a percent of 8.23, and the region, for the entire region, it's 7.64, and for Healthy Michigan, Lifeways is at 6.28, and for the region, it's 4.36. So we are serving more individuals in our community than an average within the region. The other thing that I just wanted to extend and offer to you is in relation to next week. We have our 50th celebration. We've been in Lifeways formed 50 years ago as Jackson Hillsdale Community Mental Health Board, and we are going to be celebrating that on October 20th from 4 to 7 o'clock, and extend the invitation for any commissioner that would like to attend and support the agency in this accomplishment. So that is it for my report.
Thank you. What comments or questions might you have for Mary Beth? Seeing none, we thank you for that information.
Thank you.
Next on the agenda, we have Community Action Agency. Laura? Hello and welcome.
Thank you. My name is Laura Riem, and I'm a Program Operations Manager at Community Action Agency here in Jackson, and I was asked to come and speak briefly about the homeless population in Jackson and then the programs that we have at CAA to address homelessness. Looking at our 2015 numbers, which is our most recent annual count that we have, Jackson County had 1,582 homeless people total. Those include people that were at the shelter, that came in through our agency as being screened as homeless. We're in transitional housing programs. Of those 1,582, 1,221 were what HUD defines as literally homeless, which means they live at a shelter on the street or someplace else not met for normal habitation, like a vehicle or an abandoned building. And of those 1,221, 100 of those were chronically homeless, which means they either had 12 consecutive months of homelessness, or over the past 4 years they had 3 episodes that equaled 12 months of homelessness. For chronic homelessness, 100 even.
So Laura, just for verification, there's no redundancy in the number countings. They're assured of that 1542,
This is an
1582.
unduplicated number, yep.
They're not duplicated.
Right, correct. Yep, so these numbers came out of our, it's called HMIS, it's the Homeless Management Information System for the state of Michigan. And so all of our homeless providers within the community are required to enter their information into that system, and then it manages it for us as unduplicating numbers, and we can pull our reports from there.
So how would we know of those 1582 that they are, we don't know that they are or were Jackson residents, correct?
Right, it just, that number is saying that they spent at least one night here and touched one of our homeless providers in the community. So some of them could have been Jackson residents, some of them could have been staying at a shelter in Detroit and ran out of time there and came to Jackson because we were the next closest shelter for them and then stayed here. So we don't know, I mean, that's information I could probably pull from the system. What did they do after they left the shelter or after they came and saw us? Did they stay in Jackson County or did they move on to somewhere else?
Do we have any number for veterans?
I don't have it with me today, but I would have a number for veterans, yes.
I'd be curious to see what the veteran number was.
Yeah, we're able to separate several of those demographics out, so, yep.
Daniel?
Just curious.
On age ranges, so I don't have it with me, but I can give you guys all of that demographic information in the report that I pulled, and you guys can have it and pass it out amongst yourselves. But I do have that I don't have the age range, but I have that we had 870 of those were single people, and then 704 were children and adults and families. 333 were actually the children portion of that, so. And then the report breaks it down pretty specifically into like age ranges every, I think it's 10 years. So, like children 1 to 10, 11 to.
Okay.
So I could
So,
give you
yeah,
lots of
I think as
demographics.
we're talking about submitting that, if it went through Delane, through the county administrator's office, then it could be attached to this so that we have this for
Okay.
future reference. That would be great. So that if any of the public wanted that same information, they had access to that.
Sure.
that
Yep,
data.
absolutely.
Thank you.
Sure. And there were eight of those households were also unaccompanied youth that fell into that category. So the way that our county is set up, or that we're required to process people that are homeless, is that we have what's called a coordinated entry, or they call it the HARA in the state of Michigan. It's the Housing Assessment and Resource Agency. So Community Action Agency is that agency in Jackson County. We are supposed to be the single entry point or the coordinated entry point for everybody that has housing needs within the community. So we do screenings, we build acuity levels, and then refer out to programs within the community, trying to make it simpler for someone that's already in crisis, so that they're not having to tell their story multiple times as they go to the shelter and another service provider and then back to us, however it would be. So in the last fiscal year, we had about 3,000 housing inquiries. We get about 700 to 800 every quarter. These housing inquiries could be from people that are homeless or at risk of homelessness, or they could also be from people just looking for information about how to sign up for a subsidized housing unit, or how to get on a Section 8 waiting list, things like that. We screened 812 people that met the homeless definition from HUD, and of those, 268 were single adults and 544 were families with children, combined children and adults together. Internally at Community Action Agency, we have several different housing programs to address homelessness. The most intensive of those is called permanent supportive housing, and it's just like it sounds, it's a permanent program ongoing for someone that is literally homeless and also meets that chronic definition, and an adult in the household must also have a disability to be eligible for that. We currently have 14 households that are in our permanent supportive housing program, and we just started a new grant starting October 1, and are anticipating that we'll house another 8 households in that permanent supportive housing grant. Then we have what is called transitional housing. It's up to 24 months of rental subsidy. People in this program also have to meet that literally homeless definition from HUD. Currently, we have 33 households that are in transitional housing, and we are in the process of transitioning our transitional housing into other forms of housing that HUD feels are more effective uses of funding. So some of that is moving to permanent supportive housing, and some of that is moving into what is called a rapid rehousing program, which is designed for people that need maybe 1 to 6 months of rental assistance and then can move on their own. And then we have some funding that comes through the state of Michigan. We have both rapid rehousing and what's called prevention assistance. So the rapid rehousing is very short-term assistance for someone that maybe is experiencing homelessness for the first time, or has become homeless, but they have income or Social Security benefits and would be able to take over their rent pretty quickly. Prevention is designed for people that are at risk of becoming homeless. So somebody that has an eviction from the court or is doubled up with someone that they can no longer stay with, those people could fall into that prevention category. And then we also have, this is another new grant that we've just started. It's called Supportive Services Only. This is a grant to offer case management services to all of those households that don't qualify for our housing program. So people that are homeless, but they don't meet the chronic homeless definition, and there's no other funding available for them. So we would still offer them ongoing case management services to help them house. We just wouldn't have the financial dollars to pay their first month of rent to get them started. And then we're also, as I had spoke a little earlier about HMIS, the Homeless Management Information System, Community Action Agency is the system administrator of that for our county. And so we're managing the data that's in there, making sure that reporting gets done on time for that system. One additional thing that we do, separate from our housing programs, is that we're the agency in Jackson County that places the names on the waiting list under the homeless preference for Section 8 vouchers. So anybody that is homeless can be placed on that waiting list, and it's an active waiting list. MISHDA is currently pulling names from the list. So in the last 2 months, they've actually pulled 40 names from our list, but typically they pull between 10 and 15 each month. So it's a list that's moving. If you're homeless, right now, you can only be put on the list if you're homeless. But it preferences you so that if we should run out of homeless people in our community and they start opening up to the general public, if you are homeless, you get pushed to the front of that list. And then we also have, along with housing choice vouchers, we have what are called project-based vouchers in our community. And so those are similar to a housing choice voucher, but it's tied to an apartment complex. We have 2 in Jackson County. One is at Foxfire, and the other one is at Green Meadows out in Springport. And so we offer supportive services to all of those clients that are there under the project-based voucher to help them maintain those units. It's kind of a quick version. So.
Thank you. What comments or questions might you have for Laura? And again, thank you for getting that additional information.
Yeah.
Do you have the email address, I think, to send that to? And
Okay.
we appreciate that.
Thank you so much.
Thank you. Next on the agenda, we have Region 2, Area Agency on Aging. The semi-annual report is attached. Moving on to the next item in the agenda, we have the Department on Aging monthly report.
Good afternoon. Just wanted a brief touch base with you this month, what's happening at the Department on Aging. And as the report shows, our community outreach event was the Classic Car Festival at the fairgrounds, and we partnered with the Jackson County Fair Manager, and that went really well. So next year, we'll just do a little more outreach to the general public so that we have more people coming to the event. But it worked well, and we served 435 meals, so people could get a sample of what a congregate senior nutrition meal is. And then we had the annual Senior Safe, Sound, and Secure Seminar, and that is funded by the Region 2 Area Agency on Aging, and that's in the Human Services Building. And it's information about the most recent scams that are happening for older adults and what to watch out for, both telephone and on the computer. And some other information about power of attorney and what the requirements are for a power of attorney.
Marcy, it's interesting you should say that. I have had 2 people contact me in the last week to talk about scams on senior citizens. And that really is a lot more prevalent than we all realize, isn't it? I mean, whatever's popping up on a screen and someone not understanding that you don't need to give your credit card to get your computer fixed at home, and that you don't need to write a $5 check to be entered into that multi-million-dollar lottery drawing. And it's one issue after another.
Right, and the Social Security office will not call you. They'll send a letter. They won't call, because that's another scam is you're going to owe back taxes, you need to pay the IRS, I have this account that you need to send the money to. That's another one. That and Medicare and as an agency and Social Security as an agency will not call people.
So are there any programs in place right now currently to be proactive to help educate the seniors?
Just having talks with groups of older adults to warn them and warn people who are family members.
Yes.
That have contact. So yeah, it's word of mouth, and we just try to, as well as things like Senior Safe, Sound, and Secure and other events. And in our newsletter, we have a section that talks about recent happenings. It's mostly related to scams, but so we try to circulate the newsletter as well. Every year, the Area Agency on Aging comes and looks at our records, some samples of client records and fiscal information, just to make sure that we're following all the state and federal guidelines for the grants that we receive. We receive 15 grants, and that happened in September, and we received the results for both the fiscal component and the program assessment, and everything went very well. So we appreciate all our staff who keep track of all those meals delivered and hours provided for home care and people attending senior site events. There's just a lot of record keeping, and people have been very diligent about keeping up with that. And also connected with that, then every 3 years we apply for grant funds through the Older Americans Act, through the Region 2 Area Agency on Aging, and that includes state funding as well. So all of our grants that we applied for, we were awarded the funds. So for the first year, which started October 1st, this month, $846,000 is the grant award. So that's a very important function or piece of our resources to be able to provide services. So. And something else that has recently occurred, we do have an evidence-based exercise classes, and that's grant funded, and the instructor for the Fit After 50 aerobics class is transitioning to a full-time position at the Wise Center. So it's been an opportunity now to talk with the Wise Center about having more evidence-based classes at our site, at the Human Services Building, depending on space availability. But we're hoping to then partner with them, and they will provide an instructor for the aerobics class, as well as we would like to start a class about better balance. Because falls are one of the number one reasons that older adults go to the emergency room and then are admitted to the hospital. So to maintain balance or improve balance is something that's very important. And we've had classes called Matter of Balance, but an evidence-based exercise class would actually strengthen people's core and help them to have better balance. So we hope that might happen in January. So, yeah, any questions?
No, I'm smiling because I'm thinking of evidence-based weight loss programs. That sounds, sounds good. Any comments or questions for Marcy?
Yeah, I just have a quick question. Do you know what some of the current scams are that are being sent to seniors?
Mostly it's through the phone, and it's they say they're from the Social Security office or Medicare, and you have to buy a different supplemental insurance, and it needs to be this particular one. And then online it's a pop-up message or an email that says your computer's been infected with a virus. But there's also people that are following up on calls that say, if you send me a check for $100, then I'll be able to get my money out of a foreign account, and I can send you $1,000 because you helped me out. Some people are actually falling for that still. And another one that I don't know if it's as prevalent recently, but people can convince the person they're calling that they're a grandchild. And I went on a vacation, and I did something I shouldn't have. I'm in jail. Could you wire me $100? And they're just very adept at, well, this is your grandson. Oh, this is Jimmy? Yeah. And they'll just carry on the conversation, and it's they're very trained and very skilled at doing. So we warn people to be so cautious on what you say over the phone, and especially if you don't know who the caller is. And if you think you know who they are, then you hang up and you call them back because you know their number. You know your grandson's number, or you check with your daughter or son, is Jimmy on a vacation, that type of thing. So those are the top ones that keep surfacing. Yeah. No.
Thank you, Marcy, for that information.
Thanks.
Next on the agenda, we have Animal Shelter Third Quarter Report. Hello, Don.
Hello. Good afternoon, ladies and gentlemen. Hope your weekend was well and you got out and about. Your staff report that was submitted has tables at the end, and they were lacking the last week of the period, so I have hard copy here.
Looking for a motion to receive? We have motion and support. All in favor, say aye. Opposed? Thank you.
So yes, that what you have in front of you now, the hard copy, is the last week of September. The preliminary data had been as of September 23rd. So to get on with my report, a few things. Officially, we have three-phase power at the shelter. After 2 years of various attempts and moving forward, going backwards, what have you, it actually is in place. I have actually made contact with Steve, the washer guy, who started this whole process in the very, very beginning with an offer of a refurbished, used commercial washing machine, but they need three-phase power. We only had single-phase at the shelter. So lo and behold, the last stumbling block will be just waiting for a decent used machine to come back through his warehouse and then get placed into the animal shelter. The three-phase power obviously is a big help to facilities down the line when they decide to replace the heating and cooling units up on the roof, because you can get more efficient equipment with three-phase power, cheaper to run, more durable, less moving parts essentially. So that's a big thing for us. Well, obviously I lost my part-time shelter attendant, 20-hour position. I actually had an interview this morning, a very good interview I might add, and I intend to place an offer by the end of the week to somebody, not necessarily this one, because I have 2 or 3 other interviews to conduct this week. One of the recent projects that Friends of the Animals conducted, or actually paid for, was in the small dog puppy room. The chain link gates were replaced with stainless steel tubular gates from Shoreline. It's a more sanitary situation, easier to clean. And it's just aesthetically more pleasing in the puppy room. There's a couple little things that still need to be done, but as part of that project, we have 2 kennels that have secure tops, so the occasional escape artist dog that can climb we now have a place to put them. And obviously you all know about our doubly expanded parking lot that facilities did earlier this summer. And that'll kind of be put to the test on October 22nd. We are having a large event at the shelter. This is the Bissell Clear Out the Shelters event. It's a nationwide event, statewide, nationwide. This is our first time participating. And Bissell Corporation pays for the adoption fees of the animals that get adopted out on that particular day. So we're expecting big crowds. We'll see what happens. And then, moving on, as you can see, we had quite a few events that we participated in, had a presence at. I'm not going to go into all the details. We had a presence at the Hot Air Jubilee, for instance. One of my main volunteers attended the Reality Chance Horse Rescue fundraiser. We were down at Fair Week and joining the Health Department fair booth. We participated in the Buck Cottage's second annual fundraising event, and then we were also at a Tractor Supply event. We actually regularly go to their events almost on a monthly basis, and in this past Sunday, just yesterday actually, we were at the Airport Road location for their market day situation. I don't have the information from that particular one, but all in all, the point to take from this is, I'm coming up to my 3-year mark here. My first year, we did very little or no outreach activities like these at all. Last year, we started stepping that game up a bit and started going out, and we've really increased it more this year. We're not always getting dogs or cats adopted out as a result of these events, but if you think about the balance sheet, this is all goodwill, and which is on the right side of the balance sheet, and moving forward, we're essentially bit by bit fighting the old reputation, which still pops up every now and then, every little bit of this helps down the line. And then the following tables, you have the most current information. And what I really want to point out to you that I didn't think it was possible, but actually now that I think back, that last week of September, we added 51 cats came in that week, 24 dogs came in that week, so that got added to the numbers. And overall, we are actually 300 animals above last year's 9-month rate. So year-over-year data on the second page, or actually the second table down. So far in 2016 through September 30th, we've had 1,150 cats and 856 dogs come through the front door. And like I say, that's about 300 animals above last year's 2015's intake numbers through 9-30. The really key thing is compared year over year, let's look at cat adoptions. And in this third quarter, we had 409 cat adoptions compared to 175 last year's same time period. I think that's very, very significant. We're about 30 or 35 dogs above last year's same adoption rate. And it's all boding well. Are we perfect? No, but the numbers are boding well. It's been an extremely busy summer. Losing my 20-hour part-time position didn't help matters over the past 5 weeks or so, but we persevered, and we're getting there. We're just coming to the end of the third wave of kittens. We seem to be starting to see a small slowdown in the rate of the kittens coming in. So that's my report.
Thank you. What comments or questions might you have?
In the past Septembers, have you seen this type of growth also, or is this just a very unusual September?
No, generally speaking, there are 3 waves. Obviously, the first one getting started in March, April, depending on the length of the winter, the temperature of the winter, a lot of variables along those lines. We'll have another blip in midsummer, and then the final blip in September-ish and into October. Obviously, this one, we're 300 animals above last year, 200 of which are cats and kittens. And we're attributing it to last year's warmer winter and this summer's very hot summer.
Another question too, and that is in regards to the owner request cremation. Do they pay a fee for that?
For owner request euthanasia, yes. For cats, it's $30. For dogs, it's $45.
How do those fees compare to local veterinarians?
We might be a touch low by $10, $15 in that range on that one. I haven't changed fees at all since I've been here. Well, it probably depends on the clinic, would be my guess.
Both, he said.
Both, yeah. So the dogs are probably closer to 100, 125 in the private vets. But it depends again on which vet you're going to, where, size of the dog.
All right, thank you. Chairman Shotwell?
Your Bissell event, is it just retrieval of animals and that's pretty much all that's going on? You don't have anything set up in the parking lot or any demos or anything like that, do we?
Well, no, actually, we're trying to make it a festive event, similar to last year's Halloween event. And as you noticed, we collected a fair amount of donations. We started putting the cookie jar out when we're at these at these events that we've been doing the outreach with. So we're tabulated those dollars. We're using those dollars to help defray the costs of the Bissell event on the 22nd. So similar to last year, we're having a bouncy house there for the kids that are coming with their parents. And it's not retrieval, we're actually trying to move the animals out of the shelters. And so it's an adoption event. It is it's going to be a 3-hour event because that's what Bissell dictates in our normal business hours. I hope that answered the question.
And we've contacted the township to make sure we're not in violation of any of their local ordinances on having an event on the site?
Well, I did last year, and they had no problems last year, and so I made the assumption that they had not changed their ordinances.
My concern is neighbors.
Right. And, Mike, you were there last year. We're in the parking lot. We're not doing any activities behind the shelter, and that's where the residential neighborhood is. So we're not...
It's fine, it's nowhere near.
Right. Well, perhaps but we are having a little activities there. We're collecting. I'm not exactly sure what the kids' activity is, but we're collecting toilet paper rolls, the cardboard rolls, to do something for the kids.
All right, thank you.
And one of our newer volunteers over the past month or two had been living in California. He's actually a dog trainer, and he's actually going to be doing a couple demonstrations. I believe we have somebody else coming in to do some other dog demonstrations, dog training demonstrations, stuff like that, to basically entertain the folks. Let's hope for good weather, because if it's bad weather, the lobby's not that big.
All right, thank you. Seeing no other questions or comments for Don? All right, thank you for that information.
Thank you.
That leads us next to the Health Department monthly report.
Good afternoon, all. My monthly report is, of course, in board docs, and hopefully you maybe had a chance to look at it. I scanned it as I was sitting here this afternoon, and just want to make a few updates to some of the content. Under emergency preparedness, we talked about the Zika virus update. I try to do this every couple months for you. There are a lot of links in my report, from everything from travel advisories to testing guidance for healthcare providers, World Health Organization links concerning guidance on preventing sexual transmission, and also guidance for Michigan birthing hospitals. I included a current view of Zika virus cases map on a national basis. This was as of September 8th. It has changed a little bit since I originally put the report together. Michigan is probably now in the 50 to 100 coloration on this map. We were 23 to 49, but as of probably last week, we've had a total of 68 travel-related cases where Zika virus has been tested and found in people. And also now, for the first time, we actually have detected Zika virus in 2 pregnant women in the state of Michigan. So it is here in terms of people picking it up from their travel around the country and the world. And we'll just continue to monitor it as best we can. We don't have any of the mosquitoes in Michigan, so we're not going to see local transmission occurring. September was National Preparedness Month. Our focus for week 3 was on preparing together, and that's really about encouraging residents to take the time to learn what types of emergencies could happen specifically in the county and what steps needed to be taken should an emergency occur. And it's really about talking to other people, your neighbors, your friends, and your relatives to make sure that you're prepared. The School Immunization Procedure Manual and Regulation has been shared with the school superintendents on September 16th, and we're doing some follow-up with the specific administrative staff and school secretaries to get more input concerning that particular manual. And then once we get that information pulled together, we'll share it back with the superintendents through the ISD. But it's been well received at this point in time. We also were asked to provide some input into the annual Jackson Health Network Value Report that is now published on an annual basis, and I did provide that input for them. And when copies are available, I'll make sure that all the board members get one of those too for information purposes. Under health integration, a lot has been going on with our state innovation model work here in the community. Not only did the Community Clinical Linkages Committee continue to meet and engage, if you will, with the planning and design of the project effort in the county. With that funding, we're going to be, through Henry Ford Legion's Health, we'll be hiring a full-time coordinator to support the work of developing that community information hub, if you will, for social services system that integrates with the clinical delivery system. And that position should be posted now. But in addition to that, which I haven't identified here in my report, is that Henry Ford Legion's Health is also hiring a SIM project manager and a community liaison position as well. So that's what those resources are going to allow us to do to get that work done. So we're really excited on our efforts to move it forward. Financial stability network policies and procedures. I participate with the group members in helping develop policies and procedures for the network and for the coordinating council, and those were approved on September 28th, so that continues to move forward along the coordinating council model that we have in the community, and there are quite a few of those operating now. An insurance gap work group was formed of the Health Services Access Coalition, and that really is focused on coordinating our community-wide efforts to identify people who could be eligible and enrolled in the Healthy Michigan Plan or the Marketplace insurance plans, and anything else that they might be eligible for in the community, including the Children's Health Insurance Program and Medicare. So a first meeting of that work group took place on September 22nd, and we're pleased to see that that work is moving forward as a result of that coalition's efforts. The assessment of program duplication kind of is linking back a little bit to the Accountable Health Communities grant that we worked on earlier this year and decided not to make the application for that. However, there was an assessment requirement associated with that particular grant, and we kept working on that because we realized that it had a lot of direct connection to the SIM work that we're now doing in the community. So there will be a work group meeting of that takes place on October 31st. We've finalized the assessment, we've completed the report, and now we just want to bring the work group back together to make sure that it reflects what we understand to be our common approach to providing social services and doing screening amongst all the community service providers in the community. That screening work is directly connected to developing the community integrated social services system hub that we want to create. So it's a nice tie-in. We've seen a Legionella case increase in the community this year so far. These numbers are not large. We average between 0 and 4 cases per year, but so far in 2016 through September, we've seen 8 cases, which is unusual for us. So that's a pretty significant percentage increase, if you will. It's not a high increase, if you will, looking at it from a case rate per 100,000, but still we want to pay a lot of attention to this. The city of Flint obviously had some significant problems with it, and we want to make sure that we're on top of it here in Jackson County.
Isn't it related to stagnant water?
Well,
The consumption thereof?
Well, it's not necessarily just stagnant water, but there is some information in my report about it can become a health concern when it grows and spreads in human-made water systems like hot tubs, hot water tanks and heaters, large plumbing systems, cooling towers, and decorative fountains. And it grows best in warm water. It's not just associated with stagnant water, although stagnant water in a plumbing system does create the potential for more replication of the bacteria. So that part is correct.
Is this different?
It is the same thing. Yep. Just to kind of prepare more of a community response to this as well, today we did release a public health advisory to healthcare providers in the community to make sure that they're all aware that we've seen a case increase. We haven't identified any common factors. There's no common source at this point in time. We've talked to the specialists and consultants at the Michigan Department of Health and Human Services. We've talked with the city as well about the city municipal water system. There have been no major changes there. So we just have to keep monitoring this and looking at it.
Are these people in the general population, though?
They are residents of Jackson County,
I
yes.
understand. Are they in the general population, or are they in a care home facilities type environment?
That I'm not entirely sure of. I don't believe that they're in a long-term care setting, if that's what you're asking.
I'm just asking
Yes,
if they are in the general
right.
with the water supply. Their immune system.
Right.
Type of problem, that's why.
Yep. No, we haven't identified a residence or residential location in long-term care as one of the factors at this point in time. 3 of the cases have been on municipal water system. 4 of them have been on private wells in the community, in their living locations. So we've not identified any other common source that we can really focus in on at this point in time. We are also doing a press release this afternoon to the general public as well to let people know about this. And if they have any concerns that they may have signs and symptoms of Legionella, we're directing them to get in touch with their healthcare provider right away. So that's the preventive action that we're taking right now. A little bit of update on our clinic reconfiguration project at the Health Department. We are pretty much complete with that project, and one of the good things I think I can share with you as a result of having completed that work is that our clinic hours now for the immunization clinic are expanded from 9 a.m. to 4 p.m. Monday through Friday. The way that we were separated in the past and not having our nursing staff combined really prevented us from doing that. So we're really excited that we can now have the clinic open 5 days a week from 9 to 4. So that's a great outcome for us, better service to our community. Under health education and health promotion, the car seat safety program was active in September at the Green Market with Henry Ford Legion's Health, and our technicians inspected 25 car seats. We distributed 18 free brand-new car seats and destroyed 9 of them. That happens pretty much every time we have these events, and it was well-attended, and traffic flow was steady. Child Passenger Safety Week was September 18th through the 24th, and that week concluded with National Seat Check Saturday on September 24th. And just as a reminder for all of us, the importance of car seats, and particularly for children, is that motor vehicle crashes are the leading cause of death for children 0 to 13 years of age. Not that 13-year-olds are in car seats, but we certainly are focused on the younger age group that does need to be in car seats. This is a couple of Healthy Communities updates. We have made an application to the Jackson Community Foundation for a community impact grant to further support the Friends of Loomis Park effort. Julie Weisbrod attended a city council meeting on September 20th to advocate really for some continued hours of operation for the city parks to help make those accessible and available to people more of the hours that they typically have been. And the council, I think, generally agreed with the suggestions, and they may revise the ordinance prior to it being final approved. We're also looking at applying for a $25,000 prize through the Robert Wood Johnson Foundation for the work that we do here in Jackson County. I think we really collaborate together well, and this is a prize, it's not a grant, so there are no other funding requirements or programmatic requirements associated with it. It's just a prize for doing a really good job of coordinating our effort. We offered on September 23rd a free EPA renovation, repair, and painting training certification class for lead safety. We've done these in the past. It's been pretty much on an annual basis at this point in time, but Rhonda Rudolph was very much involved with helping organize it and coordinating it. And just as a reminder that federal law requires contractors and painters and remodelers, window replacement companies, rental property owners, and those interested in lead-safe remodeling who disturb lead-based paint in homes or childcare facilities and schools built before '78 to be certified and follow specific practices. So that's why we offer it in the community. Under environmental health, we've been, I think, keeping people pretty well up to date on 1276 Levant Street. This is a home in Summit Township that was identified as uninhabitable and due to nuisance and unsanitary conditions. Summit Township also posted the dwelling under their damaged building ordinance. And Don Haydick and his staff have worked together to identify firms that we thought could do a quick process of fumigation of the exterior and interior of the home, as well as picking up and disposing of the carcasses of the dead animals that were identified in time. That's been completed, and the cost was about $600, and we will place a lien on the property for that to be recovered in future years. Yes, sir.
Would it not be a good idea to maybe put out a request for services on an annual basis so that we have these guys lined up, in advance? Maybe we know who the contractors are that can step right up so we can call them within 24 hours to begin alleviation of problems like this, because I'm aware of 2 more homes that easily could become this way.
Okay.
And I just to save us, some effort and be ready for a situation like this. We've all heard of the cat lady in the neighborhood and that type of stuff, and this is the cat lady gone bad type environment, very bad. And I really feel for the family and everyone involved. But I'm thinking if we could be a little bit more proactive on the front end, then we could be ready to assist the townships when they have an incident like this happen and get it so the neighbors are protected and so the other animals that are in the neighborhood and that type of stuff are protected also.
Yes, we can certainly do that. Thank you. And that's my report.
John?
Do you know offhand, when you'll be here in the county building doing flu shots?
Well, it's probably in the month of October, maybe slightly into November. That's the time frame that we're doing them. I don't know the exact date, John.
Okay, I'll look it back up. I know it's on your website, right?
It might be posted on the website, but we did send the information out to all county employees by email. So, yeah, thank you. Thank you. This is another one of the Medicaid health plans that we will need to contract with going forward into 2017. This one is very much similar to the ones that you've already seen come through the Human Services Committee and to the full board. It's a new contract agreement with Meridian that specifically allows us to bill for maternal infant health program services, because that's shifting from MDHHS to the health plans now. It's pretty standard process and procedure for these health plan contracts now. This has been reviewed by legal counsel, and we would encourage you to consider approving this for us today. I think it puts us in place to be able to maintain services and make the billings.
All in favor, say aye. Opposed?
Thank you.